Okay, well, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. So, for those who don't know me, my name is Dr. Arinola Dada, and we just started this Facebook group called Gout Support Group. So, I have today an amazing physician. Her name is Dr. Julia Buchfuhrer, and she is an expert at gout too. So, you're going to get two for the price of one, and we're going to talk about a number of very interesting topics. But before we do that, I'm going to tell you a little bit about my dear friend Julia. So she's a founder of JP Arthritis and Rheumatology Center in LA, and she has over 7 years of experience in the medical field. She did her rheumatology fellowship at the U of A and served as a sub-investigator. So served as an investigator in numerous clinical trials. She did internal medicine at UC Irvine and was introduced into the Gold Humanism Honor Society for her compassionate patient care. So she started her own YouTube page, Room Answers, where she answers burning rheumatology questions for everyday people. Okay, well, everybody, and she's a mountain biker, skier, scuba diver, rugby player, hiker, and cyclist. Okay, everybody, this is going to be a fun time. We're going to talk to Dr. Buchfuhrer, and we have interesting things to talk about. And welcome, Julia, to our show.
Thank you for having me. I'm so excited to be here. I watch you all the time on the treadmill, getting your questions answered while getting your exercise on. So it's lovely to be here.
Thank you. So, so today, we launched the Got Gout channel. So we're going to talk a little bit about gout, but something else that's actually very interesting at this time is clinical trials and people participating and the opportunity for us to move further with science, right? A little blurb is, a New York Times 2 days ago, the sickle cell cure. The first young man, he's going to get the gene therapy for sickle cell disease.
Wow.
So it's an amazing time in science, and the most common questions that we get asked by patients is, how long do I have to be on this medicine?
Oh yeah. Oh yeah. That's always one of the top questions, right?
Yeah, which is basically, do you guys have a cure, right? That's it,
Right.
right?
Yeah.
That's it. So I would like to ask you, and I think minds want to know, what are your thoughts, right, about clinical trials and how they could benefit even gout patients? Any thoughts about this?
Yeah, I mean, look, Dr. Dada, we've known gout exists, if you look back in the records, since 500 BCE, right? And we didn't get our first real treatment with allopurinol until the 1950s. So long, long time of people suffering with gout with
Yeah,
zero treatments.
yeah.
And now in the US, at least, we only have four since the 1950s. We just could be doing better for our gout patients, and that comes with clinical trials.
Yeah. What are those for treatments anyway?
Yeah, good question. So we have allopurinol, which is by and far the most common treatment. We have febuxostat, we have probenecid, and we have pegloticase, which is our infusible right now.
Yeah, yeah. Okay. So, what advancements, do you think that clinical trials will offer to people, right? Because it's like, oh, there's a clinical trial, do I want to join or not? And what are the benefits, right? Would you
Yeah,
say?
I hear a lot of people say, well, I don't want to be a lab rat, right? Well, I kind of turn it around. You get the first chance at having a new therapy. So, in 1956, when they were coming out with allopurinol, if you were in that study, you got the first chance of having the first true gout treatment. And the same is true today. When they were studying pegloticase, which in my opinion is probably our best gout medication out right now, the people in those trials got to get the gout out of their body quicker than anyone else. And like I said, we have 4 treatments, but I'm hoping we'll have 5 and then 6 and then 7. And they may be better than what we have now. That's always the goal. So
Yeah.
you get the first shot at having a possibly better treatment.
Yeah. Just as you said, pegloticase, it just occurred to me that people may not know what that is. Should we
Mhm.
use the generic? Can we go back into those 4 treatments and use the generic names so
You
that people are familiar with?
yeah.
Yeah.
So allopurinol, fully generic. I don't think it has
Yes,
a
that's allopurinol. Yeah. Yeah.
yeah. And then febuxostat is also known as Uloric.
Yeah. I think, yeah.
Pegloticase, which you mentioned, is also known
Yes.
as Cristexa. Everyone
Yes.
knows it as Cristexa, right?
Yes. Everybody does. Yes.
And then probenecid, I'm not actually
I
sure.
think, yeah, I think that's probably so old that I think
Yeah,
that's probably the generic name. Okay.
yeah,
Yes, it
yeah,
just occurred to me as you were saying pegloticase. I was like, I don't think patients are going to know that.
yeah,
Okay.
yeah,
Perfect.
absolutely. Everyone
Yeah.
calls it Cristexa. I
Yeah.
was
Everybody goes.
go by the drug name. Yeah.
Yeah, yeah. Okay, so since we're talking about gout, right? Can you share with, our listeners, who have had gout, any tips on, how to manage a gout flare? That's the number one question is, I have pain. How do we manage this? I can't get in to see my doctor. How do you manage a gout flare?
So I always tell my patients early and often, right? Don't wait 3, 4 days for it to be so bad that now you
Mm,
need to go to urgent care, emergency room, or
yeah,
you're begging your doctor to let you in.
yeah,
Treat it early. The second you feel that inkling, you know how that feels. The
yes,
second you feel it, take
yeah,
your colchicine, take
yes,
ibuprofen, your Aleve, whatever your
yes,
doctor has given you,
yeah.
take it. And if you shut it down right at the beginning, that's the best thing you can do. And that's the best way to get rid of that flare.
Yeah, totally agree. I always use the analogy of a fire because
Mhm.
I'm dramatic. So put the fire out. Exactly. I totally agree with what you're saying. Put the fire out when it's just a little candle burning before it becomes a whole forest fire, right?
Yeah, I think patients don't want to bother the doctor.
Mm-hmm.
Maybe it won't be a gout flare, but
Yeah,
when you've had a lot of them, you kind of know. And
yeah,
let's say it's not a gout flare, taking an extra colchicine, Aleve, taking an
yeah,
extra ibuprofen isn't going to hurt you. So,
yeah.
it better be on the safe side.
Yeah, totally agree. Yeah, the earlier you take it, and I totally believe in colchicine as, and it's always nice to, even when you're going on holiday, make sure you have it in your back pocket.
Oh, absolutely. I can't emphasize that enough because that's always when it flares up, right?
Yeah, yeah, yeah. And I've asked the patient, like, hey, if you have an attack, I can come and take care of you.
Fly me out to Barbados, right?
Fly me out. Or you can just take your colchicine with you. They'll be like, I'll take my colchicine. You're expensive. Okay. Can you share kind of a story about a patient who's had kind of a really amazing result after being under your care?
Yeah, I think almost all these patients are our Krystexxa patients, right?
Yeah.
Because
Mm-hmm.
Krystexxa works faster than any of our other drugs. So I have quite a few, but one in particular, gentleman came in just riddled with tophi, which are
Mm.
these, as you know, but maybe the viewers don't know.
The viewers do not know. Yes,
Yeah,
please
so just
expatiate.
you know, deposits of uric acid or the gout crystals all over the body to the point where I could see them, I could feel them. He was crippled and he just couldn't get around. And not only was he flaring up probably every week, but even between flare ups, he had just chronic pain and disability.
Yeah.
He had really stopped doing everything he loved. He used to go to Las Vegas and go walk the strip and go see shows and really enjoyed doing that sort of thing. And we live in California, so the drive to Las Vegas is about 4 hours, unless there's a traffic jam, which does happen. But he couldn't do that anymore. He said after the
Yeah.
4 hour drive, I got out of the car and I had my cane. I was just crippled. There's
Yeah.
no way I was walking the strip or doing anything.
Wow.
After 9 months of Krystexxa, he actually went to Las Vegas for a work meeting, and he got out of the car, went to grab his cane, and realized he didn't need it.
Wow. Isn't that something?
Yeah,
Wow.
yeah. So
Wow.
he actually wrote me an email from Las Vegas
Oh,
telling me how I changed his life. And obviously it wasn't
wow.
me. It was the medication that he was compliant with and that he stuck with. But
Yeah.
those are
Yeah.
the moments that really make this
Yeah.
job worthwhile.
Yeah, that is so touching. But yeah, right. It wasn't you. It was you and your team. It was you, the patient, the company that created the medicine that allowed all three of you to be able to get him to where he needed to be. Because he had to kind of be persistent with the treatment because every 2 weeks, but he also had to listen to your wisdom and your expertise. And you had to kind of be there and hold his hand through it to make sure that he was able to be compliant. So, congratulations to you, the patient, and the team that helped him to get to
Absolutely.
his, yeah, to get to that out. You know, as you were talking, one of the questions that people frequently well, one of the things that people frequently say is that last had a gout attack 2 years ago. I've been controlling it by, I've had multiple attacks of gout over the years, but in this last 6 months, I've not had any gout attack. And I've just been controlling it by, maybe one diet change, right? And I used to have swelling in my knees. So the person had previously severe gout. I used to have swelling in my knees. I used to drain it all the time and stuff like that. Now I'm not taking any medication. I'm just controlling it with diet. I took out red meat or something. And so now I feel I'm gout free. Do you have any thoughts about this?
Yeah, perhaps that could happen to a very small subset of people. But what our studies show is that if you maintain the perfect gout diet, right, you will only drop your uric acid level by about 1. So we know that in the blood, the saturation point is 6.8. As I know you very well know this, Dr. Dada.
Oh, but our patients don't. So yes,
Yeah,
please. Yes.
so the saturation point in the blood is 6.8. What that means that is if the uric acid goes above 6.8, it's going to start to crystallize. So let me give you an analogy. You have a cup of water and you're stirring it, stirring it, stirring it as you're pouring salt into it. That salt's going to dissolve into the water until that water is saturated, and then the salt's going to crystallize to the bottom, right? Same thing happens in our blood at level 6.8 with the uric acid. It's going to dissolve until it gets to 6.8 for most people, and then it's going to crystallize. And where does it love to go? The joints, right?
Yeah.
So, you may, if you're at a 7 and you have the perfect diet, you could get below 6.8, you could get to 6. Then yeah, maybe you can control it with diet. But for the vast majority of people, they're well above 7.8 and they can't drop it to below 6.8 to be able to undo the process of gout. Now we know with gout, it comes and goes in flare-ups, and especially at the beginning, those flare-ups aren't that frequent, right? So if you haven't had a flare-up in 2 years, that does not mean you're gout-free. That just means one bad day is going to come in the future, and you better be prepared.
Yeah. Yeah, yeah, yeah. So and so was thinking about your patient, right? And the fact, and so question is, how long do you think he's probably had gout for it to become so bad?
Yeah, he's probably had it 20, 30 years to get that bad.
Yeah.
We know that uric acid is building up even before your first gout attack. So it's depositing in the joints, depositing in until one day, boom, you get your first gout attack.
Yeah.
And then it keeps depositing till your second one. And then these attacks become not only more frequent, but they'll start lasting longer. So
Yeah.
I can't tell you how many times I hear, well, I used to get one flare up a year. It would last 2 to 3 days. It was tolerable.
Yeah.
And now it's every month and they're lasting 2 weeks.
Yeah.
I'm really only
Yeah.
gout free half of the
Yeah.
year.
Yeah.
Very common story. And that just speaks to
Yeah.
how much of those crystals have deposited throughout the
Busted.
body.
Yeah, then that's so true. And I think that unfortunately is something that a lot of our patients are struggling with is I made these changes. Coincidentally, I haven't had any gout attacks, but that quietly, exactly what you're saying, in between the attacks, there's still this accumulation. And just because you can't feel it doesn't mean it's not happening. I think that's,
Exactly. Yeah.
yeah, so that's something I think I think maybe our responsibility is to kind of let more people know that just because you're having quiet time doesn't mean that that uric acid isn't depositing into your joints and potentially may cause so much damage, like your patient had to get his cane.
Yeah.
Luckily, after being under your care, he was, he like, do I need that cane? No, no, which
Yeah,
is great.
I think exactly what you said is we as doctors need to do a better job
Yeah,
educating.
educating people.
Yeah,
Yeah, and I think that's why we both have our YouTube channels.
that's right. That's right. Absolutely. We love the gout education. We love
Yes.
people free of their gout,
Yeah.
and not disabled anymore.
Yeah. So question, because you and I have so much passion for what we do, but let's hear a little bit about that. Tell me, why do you do what you do?
Yeah, so I played almost every sport, as you mentioned earlier, growing up. And in college, I played Division I rugby. I sprained everything in my body. And I was always on the sidelines trying to rehab it to get better. Or, sometimes you'd sprain an ankle in a game, they'd wrap it up and throw you
Go
back in,
back.
which they don't do anymore, but then they absolutely did. So, I know personally what it's like to have debilitating joint pain. I at times in college couldn't walk to my own classes. I
Yeah,
had to have a friend pick me up, drive me around to the other side of campus,
yeah.
and I'd crutch over to class. So
Wow.
I know exactly what that feels like.
Yeah.
And that's why I chose rheumatology is
Wow.
I don't want anyone to feel like that if I can help them avoid it.
Yeah. 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 I think rheumatologists tend to be very empathetic people. And I
Mhm.
think that story kind of resonates with the kind of a lot of people that I know that are rheumatologists. So, and so for people that want to reach out to you, I know that we both talked about the fact that we both have YouTube channels, and yours is YouTube at Room Answers.
Yes, so we just started the YouTube at Room Answers.
Yeah.
We actually just posted our first video.
Congratulations, it begins.
That's right. You've actually inspired me. I watch your videos all the time. You give excellent advice.
Uh,
It's stuff I'm telling my patients every day.
yes.
It's lovely to see you answering
Yeah.
everyone's questions. So
Yeah.
I'm actually
Thank
following in
you.
your footsteps.
Love it. We got to spread the word. Let's spread the
Yep,
word.
yep, absolutely, absolutely. So yeah, I'm excited, very excited.
Good. Okay, so patients want to find rheumatologists, and so can you tell us all the different avenues in which patients can get in touch with you or maybe work with you in future?
Yeah, so my website, jbarthritis.com, JB being my initials. You can find us there. We have a web form, we have all our information. You can call us. We'll always try to get new patients in as quickly as possible. It's hard to find a rheumatologist sometimes. You'll call, they're booked out 5, 6 months if you're lucky sometimes, in some places booked out a year.
Yeah.
But especially in my clinic, for gout patients, we try to get them in quickly because
Yeah.
we know that we can reverse this process,
Yes.
right?
Yeah.
And I'm sure you're the same way.
Yeah, but thank you for that service to our patients because people with gout are really suffering and they can kind of quickly get that under control. And so I'm glad that you have. And I think it'll be important if patients, maybe when they're filling their form, can also kind of put in their diagnosis or what they think is happening, so that they can be triaged appropriately and get the care they need ASAP.
Yeah, I think that's so important. Don't just write joint pain.
Yeah,
Joint pain, we don't know.
we don't know, right?
Yeah,
Yeah.
so
Yeah.
bad gout flare happening every week, right? That'll
Yes.
get you in a lot more.
That Yeah, I would say with almost any rheumatologist, if you kind of write gout flare, they understand the pain is excruciating. So they're going to be trying to help you and kind of see through that. Okay. So we talked about website and did we talk about where you're located?
I think briefly at the beginning, but I'm
Yeah.
in Los Angeles County in
Okay.
a town called Downey, California.
Okay. Okay.
Because the area is so populated, we serve a very large area.
Mhm.
And then another thing, patients always ask me this because Los Angeles traffic, or sometimes they live in Northern California and they want to be seen by me. First visit, always in person. I want to touch those joints. I want to feel those joints. I want to get a feel for what exactly is going on. But then we can do telemedicine thereafter for most
Yeah.
patients.
Yeah.
So we can do video visits no
Yeah.
matter where you live in California.
Yeah. Okay, perfect. So we talked about your Instagram is also at Room Answers and your Facebook group, JP Arthritis and Rheumatology Center.
Yes, yes.
Okay.
Thank
Oh,
you.
well, thank you, Dr. Buchfuhrer, for coming on to the show. This was really enlightening. Thank you, everybody, for watching. If you think this video is helpful, do like it. Do subscribe to our channel, Healthy Joints, Healthy Life. If you know anybody with gout, have them join our gout support group because we're going to be having experts. We're going to have you back, Julia, talking about kind of burning questions, painful questions that people with gout have. It's really time for us to get rid of the pain that people are experiencing with gout, and let's give them their lives back. Thank you, everybody, for watching. My name is Dr. Arinola Dada. Bye, everybody.
Bye.